Hi, my name is Kim and I work here at Student Health Services, and I'm going to talk to you a little bit about making a doctor's appointment. Sounds easy, right? You just make a doctor's appointment. Till you get on the phone and you realize that you don't have any of the information that you're going to need. So let's talk about what we need. First off, don't wait too long. A lot of times what we think is super emergency important, our doctor's office might not think that. So we might not get a same day appointment, sometimes not even the same week appointment. It just kind of depends on what's going on. So don't wait too long, especially if you get to a Friday. Two, something else that you're going to need is insurance information. If you do have health insurance, you need to know who your policy is through, what company. Also, you're going to need to know if the doctor's office that you've chosen is in-network or out-of-network. So what that means for you is in-network means that your doctor's office and your insurance company have a contract together. It means that they are actually going to pay more for your visit whenever you go see them as an in-network provider. Now, can you go see an out-of-network provider with your insurance? Absolutely. Just keep in mind that you might have to pay just a little bit more out of pocket for that visit. How are you going to find out that information? The back of your insurance card, a lot of times there's a phone number that you can contact your insurance company. Now, any of us who have contacted insurance companies knows that they get a lot of phone calls, so they may not get to you right away. You may be on hold a while. So another way that you can do that is through the internet. So you can go to their webpage. A lot of times they have a section set aside for an in-network provider search. So you can look either for the network or the provider that you want. You can look by location. You can look by facility. So there's lots of different avenues for you to do. Also, something to find out from your insurance is your copay. So what a copay is it's an amount of money that you will have to pay regardless of whatever happens. It generally doesn't go towards your deductible, but you know that you're going to owe that amount. Some insurance cards have it on there so that you know when you're going there. Some of them don't, and you just have to contact your insurance company to find out how much your copay is. It's also a good question to ask the doctor's office whenever you're on the phone with them if they require that copay at the time of service or if they'll just bill you. That way you know if you need to take some money with you. So we've picked a provider, we're going to call them. We need a little bit more information prior to calling them. A good idea is to write down all of your symptoms. I know that I get to talking and I don't remember everything that I wanted to tell them. Also keep in mind that you're not talking to the doctor or their providers, you are talking to the receptionist. So you don't need to go into great detail, just specific bullet points so that they know exactly what to get to you, which doctor and facility to get you to. Something else is if you have a gender specific provider that you feel more comfortable with, you can ask them if they have someone that you feel comfortable with. Also keep in mind that if they don't have that provider, you can decide beforehand if you're still wanting to go to that provider, if you want to find someplace else that makes you feel more comfortable. Make sure you have your calendar available. Just like we were talking about, sometimes they don't necessarily can't get you in that day. And if it's an appointment for something that is more general care, physicals, that kind of thing, you might not get an appointment for 2 to 3 days or 2 to 3 weeks. It just kind of depends on where you're going into. So make sure you have your calendar available whenever you're on the phone with them. So we're on the phone with the providers. A couple of questions that you can ask before you get off the phone. You might want to ask how long your appointment is going to run. That way, if you have any other appointments that you're needing to schedule, you're not constrained for time, or you're not trying to call that other facility while you're in with your doctor's office. That way you know you have plenty of time. Also, if you have any special accommodations, if you need a translator, if you have like a service animal, if you need special parking, or if you just want to know where you're supposed to be going, like parking if you've never been to this facility, those are all good questions to ask while you're on the phone with them. Okay, so we've made our appointment, we have it in our calendar, we're getting ready for to go to our appointment. Again, make sure you take that list of symptoms, of current symptoms. Also, make sure you've written down any major treatments that you've had, any surgeries that you may have had, also any current medications that you are on. You want to make sure and take all of that information with you to the doctor's office so that they can take care of you while they're there. So if you have any questions, make sure you give Student Health Services a call. We can always answer any questions that you might have. So I hope you have a great day and a great doctor's appointment, and we'll see you later.